It's time to start your exercise routine for back pain. Exercise 1. Massaging the upper back. You need a BLACKROLL fascia roller for the first exercise. Sit on the floor with your legs raised and support yourself with your arms behind you. Place the roller just above the waistline in the area of your lower back. Lean your upper body backward and lift your buttocks slightly off the floor. The neck should remain an extension of the spine. Roll your lumbar spine along the roller. If the pressure is too much, do the exercise in a standing position while leaning against a wall. Find a painful spot and stay on it for about 15 seconds. Take a deep breath in and out. Just 5, 4, 3, 2, 1. Release the pressure and come back to the starting position. Exercise 2. Massaging the gluteal muscles. You need a BLACKROLL ball 12 for this next exercise. Place the fascia ball on the floor and sit on it with your right buttock. Place your right leg on your left thigh. Move slowly on the spot and take note of any specific tender points. To increase the pressure even more, you can hold your ankle with your left hand. Find a painful spot and keep applying pressure to it for about 15 seconds. Take calm, deep breaths. If you have any problems supporting yourself with your shoulders, put more of your weight onto the ball to take weight off your shoulders. Roll on it slowly in a circular motion. Put your right leg down and place the ball under your left buttock. Place your left leg on your right thigh. Move slowly on the spot and take note of any specific tender points. Move forward, backward, sideways, or in a circular motion. If you want to increase the pressure, hold your left ankle with your right hand. Find a painful spot on this side as well. Hold the pressure on this spot for 15 seconds. Don't forget to take a deep breath in and then exhale. Continue to roll. Tightness in your buttocks often spreads to your lower back. A massage in this area can reduce your pain. Just 5, 4, 3, 2, 1. Slowly come out of the position. Exercise 3. Massaging the hip flexors. Lie on your stomach for the next exercise. Place the ball 12 above your groin, between the top of your right hip bone and your straight abdominal muscles. Support yourself loosely with your arms. Let yourself sink down slowly onto the ball. Let yourself fall a little deeper into the ball with each exhalation. Relax here for about 1 minute. Be careful when doing this exercise. If you feel any throbbing in your abdomen, you should switch positions. Concentrate on breathing from your abdomen. Time to switch sides. Work on the other hip flexor as well by placing the ball on your left side. Let yourself sink down onto the ball again. Breathing deeply will allow you to sink ever deeper into the ball. It is important that you also work your front side in order to reduce any tension from the shortened muscles and fascia at the front of your body caused by everyday life. Take calm, deep breaths and relax. This exercise is highly recommended, especially after long hours of working in front of the computer. Slowly come out of the position by pushing yourself up using your forearms. Exercise 4. Triggering the muscles of the lumbar spine. You need a BLACKROLL TMX trigger for this next exercise. Start by lying down on your back, positioning the trigger on the painful spot in your lumbar spine. Stretch out your legs. It is important to place the trigger on your muscles, not on the bones of your lumbar spine. Take deep breaths in and out and try to relax despite the pain. Keep your body on the trigger for 3 minutes. After a while, you should feel the pain subside. For additional mobilization, bend your legs and swing them slightly to the left and right. Treatment with the trigger tool promotes blood circulation and helps your tissue to regenerate. In order to be able to release tension in the tissue, oxygen-rich blood must reach the cells faster, and oxygen-depleted blood must be removed more easily. Just 1 more minute. Keep going. You are almost done. You're down to the last 30 seconds. Switch sides by placing the trigger on a painful spot on the other side of the spine. Relax and let yourself sink deeply into the trigger. Trigger for 3 minutes. Once the pain subsides slightly, start mobilizing the muscle. Bend your legs again and swing them to the left and right. They should only be small movements. If mobilizing the muscle hurts too much, then simply maintain the pressure on that spot. Treatment with the trigger can seem like it takes a while. However, in order for your body to feel the positive effects, you should linger on a painful point for at least 3 minutes. Try to relax as best you can. To do this, focus on your lumbar spine. You may experience muscle soreness, slight aggravation of the pain, or bruising after using the trigger. There is no reason to be concerned. These are some of the normal effects when you treat a muscle with the trigger. Just 30 more seconds. Slowly come out of the position. Exercise 5, triggering the gluteal muscles. For the next exercise, position the trigger on a painful area of the buttocks while sitting down. Let yourself sink slowly down onto the trigger. Try to relax. Keep applying pressure here for 3 minutes. Take deep breaths in and out into the painful spot. After a while, the pain should subside slightly. For additional mobilization, you can then slightly raise your thigh and lower it again. The trigger tool uses an acupressure technique. This enables you to pinpoint areas of deep-seated tension. The goal is to eliminate the pain of myofascial trigger points. Trigger points are local areas of muscle tightness in the skeletal muscles. The massage therapist uses their thumb to treat the painful trigger points. The BLACKROLL TMX trigger acts as your therapist's thumb at home. Keep going, you're almost done. Just 30 more seconds. Switch sides by sitting on the trigger with your other buttock. Relax and let yourself sink deeply into the trigger. You can vary the pressure on the trigger using your arms. Maintain the pressure on the trigger point on this side for about 3 minutes. Once the pain subsides slightly, start mobilizing the area by slightly raising and lowering your thigh. You can repeat this as often as you like, as long as it feels comfortable. Just 30 more seconds. Slowly come out of the position. You're done. Exercise 6. Stretching the hip flexors. You need a BLACKROLL super band for this exercise. Attach the band to an object at hip level. Place the super band around your right thigh from the front and bring your right leg back. The left leg stays in front. Tense your stomach and buttocks and push your pelvis forward. Place your hands on your left knee. Hold this position for about 1 minute. Let the band pull you deep into the stretch. If you want, you can also do some small rocking movements. Take another deep breath and let yourself fall deeper into the stretch as you exhale. Slowly return to the upright position and switch sides. Slip your left leg into the band. Bring your left leg back and assume the lunge position. Bring the knee back to the floor. Let the band pull you into the stretch. Make sure you keep your torso upright. Take deep breaths and fall into the stretch a little further with each exhalation. If you want, you can also do some small rocking movements. If you sit a lot, your hip flexor muscles are often shortened. This stretching exercise counteracts this. You're almost done. Just 5, 4, 3, 2, 1. Push yourself back and come out of the position. Exercise 7, stretching the backs of your thighs. You need a BLACKROLL superband for this next exercise. Stand in an upright position and put the superband around your right foot. Hold the band in your hands. Lie down on your back slowly and place both legs on the floor. Actively raise the right leg with the superband as high as possible. Use the band to pull your leg further into the stretch and remain in this position for 1 minute. If you can, go a little deeper into the stretch the next time you exhale. Bring your leg back to the middle and come back into an upright position. Switch sides. Place the band around your left foot. Hold the band in your hands and lie down on your back. Raise your left leg as high as possible. By pulling the superband, you can vary the intensity of the stretch. Stretching mobilizes the connective tissue, relieves the joints, and supplies the corresponding area with blood. All of your tissue will be smoother and more resistant. Relax again, and if you can, increase the stretch a little when you exhale. Bring your leg back to the middle and come back into an upright position. Exercise 8. Arm support with arm and leg raises. You need a BLACKROLL superband in your resistance of choice for the next exercise. Place the band around your left foot and hold the other end with your right hand. Get down on all fours. Raise your right arm and your left leg at the same time. Repeat this 10 times. 4, 5, 6, 7, 8, 9, 10. Take a short break. Now switch sides. Place the band around your right foot and your left hand. Okay, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a quick breath and switch sides. Be sure not to let your spine sink down too low and make sure you can keep your core engaged. Challenging, isn't it? You can do it. Just 2 more repetitions. Place the band around your left foot and hold the front end with your right hand. Okay, get started. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Time to switch sides. If you need a longer break between sets, just pause the video. We're going to keep going. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Nice job! Exercise 9, rolling plank. You need a black roll fascia roller for this strengthening exercise. Assume the plank position and place your forearms on your black roll. Turn your palms to the ceiling. Draw your belly button in toward your spine. Keep your back straight. If you want, you can further intensify the exercise by rolling forward and backward over your forearms. Only do this advanced version if you are ready and have no pain. Take a short break. This exercise can really make you puff and pant. Take deep breaths. Are you ready for the next set? We're moving on with set 2. Assume the forearm support position on the roller again. Remember to keep your spine straight. If you want, you can roll back and forth again. Just 5 more seconds. 3, 2, 1 and break. Shake out your hands briefly. Relax for a second and recharge your energy. Just 1 more round. Get into the forearm support position one last time. To increase the intensity, roll back and forth. Otherwise, you will just be staying in a static position, but that can also be quite challenging. Keep your buttocks down. You're almost done. 5, 4, 3, 2, 1. Exercise 10, Pallof Press. You need a BLACKROLL superband for this last strengthening exercise. Attach the training band to a solid object at chest height. Grasp the band with both hands and kneel next to it in the lunge position so that there is resistance in the band. Your right leg is in front, your left knee is on the floor. Guide your hands away from your body in a controlled manner and then bring your arms back again. 8, 9, 10. Next, do the exercise on the other side. The left leg is now in front and the right is behind you. Make sure that you control the movement and execute it with force. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Time to switch sides. We are going to do that one more time on each side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch one more time to the left side. Take a deep breath. Okay, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Your back pain exercise routine is finished for today. See you next time.